think you look like you have a cold.
You can watch me so I shouldn't do it now. Let's just talk about the workshop first.
Mm-hmm. Did you get your list done?
No, what's up? Alrighty. I'm still recovering.
Well, you ready?
Good morning.
Morning, Facebook! Or afternoon, yeah, I guess.
Sorry.
It's been a long morning for sure. Good morning, this is, we are the Sex Docs, and we are Facebook Live with you right now. And we've got an amazing topic today. We're going to be specifically talking about the O and the P shot. And it is that O, if you're thinking that O. It is definitely that O. It's the big O.
And that P,
and
if
that
you're
P
thinking that
as
P.
You will be today after today for sure. So let's get straight into this. So the O shot, this does stand for orgasm. I like to say right off the bat that both the O and the P shot are invented by Dr. Charles Runnels. He's a physician out of Alabama, and for about the past 7 years, he has been doing this particular procedure and training doctors all over the world to do this very specific way of applying this O and this P shot. So specifically what it is, it's using PRP, platelet-rich plasma. In the past couple other episodes, we have talked about PRP. What this just means is we're taking your plasma portion out of your blood and we're re-injecting that back into the body. And it's been used for decades.
Mm-hmm,
and now we can actually use this specifically for helping to enhance sexual regeneration for both orgasm and for penis health.
Mm-hmm. So when we're talking specifically for the female and we're thinking about, well, why would someone be interested in getting an O or an orgasm shot? Let's first start by saying, of course, that the O shot is just a lovely and clever name to help get the attention, although it does indeed increase our sensitivity and therefore our quality of sexual wellness. But we do use it for other things. And one of the reasons, and again, we've mentioned this before, but one of the reasons that I think is probably most important, because it's most commonly requested, is for women who are suffering with incontinence, or at least perhaps they're not having incontinence where you can't make it to the restroom, but you may have what's referred to as just that dribbling or the discomfort of loss of urinary control when you're doing things like jumping rope or running, laughing, sneezing.
Right.
And this is something that doesn't just happen when you're peri or postmenopausal. This is also very common in our younger patients that are maybe postpartum. You have that 1 to 5th child, and then you definitely are not having the same control over urine as you would have. So what else? Let's talk about the actual orgasm part. What else are we doing with the O shot?
Well, and also to speak to what you're saying too, Christina, what it's doing is it's strengthening the areas in and around the urethra with this PRP. So PRP has all these growth factors in it, this nutrient-rich, this growth factor-rich portion of your blood that can be injected into the area around the urethra to help help that to stay closed. And we can do that also in and around the clitoris, which helps with sensation, nerve regeneration, increasing actual blood vessel growth that helps with blood flow and further sensation.
Yeah, and that increasing of blood growth, almost like the plumping or the enlarging of the clitoris, is really easy for us to imagine when we compare to what's happening to the penis. I don't think that women realize that it's a very similar tissue in the female genitalia as it is in the male genitalia. So the more flooding of blood into that area that you have, you're going to have an easier time to perceive the sensitivity and therefore an easier time climaxing.
Right. So, and here's the people think, well, okay, so you're injecting around my clitoris, you're injecting around the urethra, doesn't that hurt? And when it's done correctly, particularly the way it is done in the O and the P shot very specifically, this is somewhere between a 0 to 2 out of 10 on pain.
Pain scale.
Right.
Yeah.
So it should be, most women just kind of say, no, I didn't really feel anything, or maybe a little bit of pressure, but nothing more than a 2 out of 10. And really, if it's more than that, then probably the practitioner's not doing it correctly.
Yeah, I mean, of course, everybody's different, and there's always the room for that person who finds that they're more sensitive. But we really can't emphasize enough that this is for the most part, a painless procedure and an incredibly non-invasive procedure.
Yes.
Because the awesome thing about it is we're literally injecting that liquid gold. It's your body's own concentrating healing power that you're putting back into one of your most sensitive areas, which would be your genital areas.
Mm-hmm. Yeah, and that's where it's non-invasive as well, because the side effect profile associated with using PRP is extremely low, so we don't have to worry about rejection of that particular substance going back into your body. So it's very forgiving in that sense.
So how do we do it?
Well, we numb you first.
We definitely numb you first. That's how we make it a 0 to a 2 out of 10. That's very important.
And there's a slow sort of process with this. So upon coming in to the office, we would first draw your blood. And then you would be, you'd lay down, and we would be able to place you okay? We'd be able to place a numbing cream. It's an excellent numbing cream. Hurricane cream is one of the names for it. BLT cream is another name for it. But it works famously. And this is just put on topically into the area of the vulva, where we're going to be doing the injection. And that's set on there for about 15 or 20 minutes, and it's really taking place at that point, or setting in at that point, and anesthetizing the area. Then from there, we're using ice, and we're using additional lidocaine, which is an additional injection also to further numb the area. So by the time we're actually doing the procedure, you're numbed over 3 times. And it's very quick. We're done, and probably the actual procedural portion of it is maybe all of 5 minutes. So very quick, and maybe overall time, maybe 30 minutes from the time you walk in and walk out.
Very sincerely, we can say that it's a procedure that is very easy to go through, but then most important is the fact that it lasts for so long. The effects last for so long. Again, it's a gradient, but for some women, this is a one and done injection. They have it one time, they no longer suffer from incontinence, they notice that there's almost like a tightening of the vaginal canal, which again makes intercourse more pleasurable, and heightened sensitivity at the level of the clitoris, again making intercourse and the ability to orgasm even on your own that much more easy to achieve.
Yeah. And with Dr. Runnels and the group that's associated with the O and the P shot, so we're speaking specifically to the O, this is an 80% success rate now, with over 20,000 procedures being done. So that's, from a medical procedure standpoint, 80% is really, really high. Some women might have to do a tune-up maybe once every year, again, depending on what is that they're looking for and what the condition was that we were treating. There are some a little bit more advanced things that you can do. There's a condition called lichen sclerosus, which is an autoimmune condition that creates a plaque in and around the vagina. And that can actually be treated with the PRP in and around those areas that might be affected.
It's a pretty stubborn condition, and like everything else that we do at the Hormone Zone, we're taking a holistic approach. So we're not just going to say, oh, you suffer from lichen sclerosus, I know, let's do the O shot. We're going to say, okay, we wouldn't start there, or at least we wouldn't have that be your only starting point. We're always going to say, all right, well, why is this happening in the first place? Why are you suffering from an autoimmune condition? Are you predisposed to presenting with other autoimmune conditions? We're always going to look at the whole hormones involved as well as lifestyle factors, and that's what makes these interventions like the P and the O shot that much more successful and that much more worth your emotional and time investment, because you really know that you're going to be getting a thorough response.
Yeah, comprehensive care is what we're always looking at the Hormone Zone. We're going to look at the whole picture for you. So what do we expect with the O shot? Normally within about 3 to 6 weeks we should see some kind of change, whether that's incontinence, whether that's increased sensitivity for orgasm or enhanced orgasm. It should be somewhere in that time frame. And if not, we might make some adjustments. You know, and back to what you were saying to and what we were mentioning about comprehensive care, one of the first things we're going to do, if somebody comes in, let's say with incontinence, we're going to definitely look at their hormone balance, their sex hormone balance, estrogen and testosterone. That's one of the first places you start. So for a lot of women, and we've been doing this now for the past 11 years, a lot of women will come in and have incontinence or have vaginal dryness or have lack of libido or lack of atrophy or just sensation issues. And just simply adding in estrogen and testosterone is amazing what it will do, particularly the way we do it, particularly with the subcutaneous pellets that we've talked about before. That is amazing what it will do, but it doesn't always work completely or to the point where somebody's needing in their life. So enter in another procedure like the O shot.
Yeah, we're always searching for that optimal you. We don't want you to just settle for, yeah, I'm feeling better. We're always saying, well, how do we take you to the next level? And that's where these innovative procedures like the O and the P shot help take you to the next level.
We never settle, so neither should you.
Neither should you.
Right.
Sure.
So, if you could do it for girls, you can do it for boys.
Let's talk about the boys.
So the P shot. Yeah. So the P shot, the Priapus shot. Priapus is just kind of a nice way to say penis, but I guess we can say penis today too. That's really what it's for. So this is an injection therapy of the PRP into the penis that helps with erectile dysfunction. So this is a very, very common situation. Men are dealing with it all the time. They're not always very open about it. I think over the years we've probably seen more men discuss it and be open to discuss hormonal issues and erectile dysfunction, but nonetheless, it can be one of those things that can be kind of difficult to talk about.
And it's sometimes stubborn to improve. It can be resistant to treatment options. And that's why this is such a great option. And I think it has a very masculine energy about it as well. You think about it. I'm a man. I don't want to spend a lot of time talking about what it is that is a very serious concern for me and impacting the quality of my life. I'm going to do this procedure. It's short, it's easy, it's quick, it's painless.
Relatively speaking.
And you get good results.
That's right.
Right?
So again, the same thing with men, a 0 to 2 out of 10 on pain. Men are blocked and anesthetized in a really special way. It's actually called a dorsal nerve block. So first, men would have the same cream applied to the penis. It's placed for about 15 to 20 minutes. Things are extremely numbing at that point. And then from there, we proceed into doing something called a dorsal nerve block. That's quite effective. The dorsal nerve blocks are also used in circumcision, so you got to be pretty numb if you're going to do a circumcision, and that's the additional thing that's added in. So it's very, very numb by the time the procedure is taking place. And again, we're talking about another 5 minutes. There are, on the shaft of the penis, we're going to do an injection on either side, so 2 on either side, so a total of 4 there, and then 1 in the glans. And again, really simple, and you'll get a plumping effect right away.
Yeah.
The unique thing about this procedure with men for the P shot, we're also going to place a penis pump right on top of the penis to hold the PRP into place, and that's done right at the moment of the procedure. And then from there, the home care would be to go and use the penis pump for about 10 minutes 2 times a day for about 6 weeks. And what that is exercise for the penis.
Right.
And this is where you're going to actually help to regenerate. You're going to get nerve flow. You're going to get blood flow enhancement. And then the bonus with all of this, men get somewhere between a 10 to 20% increase in both size, in both length and girth.
Length and girth.
Yeah.
Yeah, which of course the male patients are very happy about.
Where do I sign?
Right, yes. But again, if you're thinking about mild erectile dysfunction or even severe, this is going to be affecting so many of the areas that have to do with erectile dysfunction, because it's going to allow for repair, which will allow for the penis to actually fill with blood, have a harder time getting erect. It's also going to allow for growth. You're going to have a stronger, harder erection. And it's just going to be healing to the area. There's nothing synthetic there. So again, when we're talking about one of your most precious areas, your genitalia, I really want to provide that comfort, letting you know this is your own healing power. It's a delicate, non-invasive procedure.
Yeah. A little bit of science just to kind of take what Mother Nature's already doing, and we're just kind of
brilliant.
Putting it. It really is. It's a very elegant process. So what do men expect with this? So again, the same thing. In about 3 to 6 weeks, they should start noticing some level of change. And it could be longer, it could be shorter. Some patients, back to the O shot, some women will notice a change within the first night. You know, sometimes they have an amazing, orgasms right away. But we're expecting somewhere between 3 to 6 weeks. And this is, again, a process where the body has to regenerate, and that this doesn't necessarily happen overnight, but we do expect results right around that time. Now, with men, again, where women maybe tend to have that ability to get it done, like one and done type of thing, or maybe once a year, men might need to do it 1 or 2 times a year, because it's, again, that sort of exercise for the penis. So the more that the PRP is placed, and perhaps using the pump in conjunction with the PRP, they're going to get better results. So if there's diabetes or some kind of blood flow issue, high blood pressure, the need for blood pressure medication, the need for cholesterol medication, these things, or any kind of cardiovascular disease issue, there might be more of a reason to continue working with the P shot over time to get the exact results a man's wanting.
Right, so for sure those are not contraindications.
Of course.
They're just
almost indications.
They're indications. They're just part of the history that may help you and your team of physicians decide how often might I need this procedure again, right? Yes. And one more comment before we move on, any downtime that they should be worried about?
No, and that's the great thing. So it's, out the door, and, for both men and women, they're ready to start using it. And this is the great bonus with that. So there's no downtime and ready to go.
Good. All right, so let's talk about...
So that's the O and the P shot.
That's the O and the P shot. And again, we welcome questions, so please reach out as needed.
Okay. So we promised you last week what we're going to do from now, moving forward, from now on. We're going to focus on the artisans of sex, the artisans of sex. And that's just bringing this idea of art and science together in any subject. Our subject just happens to be focused in and around sexual enhancement and sexual regeneration. So the artisans of sex. So I'm going to start with the science, of course, because I'm the one who likes all of that stuff. So I do want to mention that if you go on PubMed and you put in PRP and nerve regeneration, you'll find right off the bat there's 39 studies that support this idea that PRP helps to enhance nerve regrowth and regeneration. So whether we're talking about using PRP for joints in orthopedic settings, or if we're going to talk about it for the O or the P shot, there is actual evidence showing that we're increasing nerve growth, and that's really profound on any procedure to be able to actually get nerve regeneration.
Right, it's true regenerative care. All right,
so
good.
That's one thing. But the thing I was really excited about saying was I found a great study really showing, and there's more than one, but I was looking at some, that sex makes you smarter. So it's smart to have sex, and sex makes you smart. So I think that's a bonus. So there was a great study, and this was on mild cognitive impairment, or MCI. Another way to put that is age-related cognitive decline. And this is basically the step right before Alzheimer's. And we do deal with quite a bit of age-related cognitive decline here, just based on the population that we tend to serve. And so that's where the memory is starting to kind of slip. It's not necessarily that they're fully in Alzheimer's or dementia or anything like that, but it's certainly maybe those steps right before. And if you're catching those early, whether that's with hormone replacement therapy, the other things we offer here, you're helping to prevent that further decline into dementia or Alzheimer's. But anyway, so they studied this group of people, and they found that 32% had, of those that had this particular MCI or this age-related cognitive decline, 32% had recently engaged in sex, but 62.3% did not have this MCI and therefore were not engaging in sex. In other words, for the people who were engaging in sex more, had less problems with this age-related cognitive decline versus those that didn't. So sex was making them ultimately, at the very least, preventing this decline of memory and focus issues.
Wow. So that basically, in summation, means that one of the easiest things that we all have access to and complete control over is to have more sex.
Absolutely.
And protect your brain.
Absolutely. And when you say complete control, that means even sex with ourselves. So even with masturbation, we have the ability to control these things and engage that no matter what, but preferably, as we always say, with a partner.
So that's quality of orgasm.
Absolutely.
Oh, cool.
Quality of life, too.
Refer back to our video last week from Edging.
Yeah.
To learn more about how to get your brain really right before a test. Something to think about.
That's a good idea.
All right, so then let's talk a little bit about the art. Let me say that women are particularly good at multitasking, so we would say. Women are really good at having a conversation with their husband while paying attention that the child is not burning themselves on the stove, while at the same time thinking about the taxes are due, etc.
You're very good at that.
I'm very good at that. Although I'm not sure that multitasking is the best use of our brain energy, but it is something we tend to default to. One of the only times, or one of the easiest times, that it is for women to be really focused and have their brain focused on one task with a state of peace is during intercourse, and especially during orgasm. We have found that the part of the brain that is triggered or stimulated or trained to get stronger during meditation is the same part of the brain that gets activated during orgasm. So going back to this notion about how sex makes us smarter, not only does it make us smarter in just a scientific perspective, but when you're thinking about it from an artistic perspective, practice meditation, practice orgasm, practice incorporating good sex.
Both at the same time.
And both at the same time. practice making good sex be a part of your healthy, good quality of life.
Yeah.
And I'd like to leave you with one last thought that says, animals use sexual energy to replicate. Humans can use sexual energy to replicate and also to create. But geniuses are using that sexual energy as a pathway towards spirituality. So I invite you all to make your brains a little smarter.
Yeah, get closer to God.
Get closer to God through spirituality, through the spirituality with your partner, and through the joys of good orgasms.
Wow, that was awesome. I really like that.
Thank you.
Yeah. So we're bringing that artiscience right here to you. Here's what we definitely know for sure.
Hormones, they're sexy.
Look, life is sexy. We're the sex docs, and we're really excited about all of this. I mean, three's a charm. This is the third one. We're just having a lot of fun with all of this.
Great feedback, so thank
yes,
you all for your
thank
comments
you,
and likes.
Odvi and Sandy.
Oh, and Sandy.
So we'll be here again next Tuesday, 12:30 Arizona time, every Tuesday. Oh, and also next Tuesday, aside from being here live, and we're going to be talking about weight loss and how to make that all sexy, we're also going to be on 1100 KFNX at 4:30 p.m., right for that sort of drive home with Carol Blonder and Networking Phoenix.
Awesome.
So tune in, 1100 KFNX, 4:30 next Tuesday as well. But we'll mention that, of course, when we're live with you on Facebook at 12:30.
Awesome. Great. Have a wonderful week. We'll see you again next week.
See you next week.
Take care.
Bye.